In this video, I'm going to go over some do's and don'ts if you have a bulging or herniated disc, whether it's L4, L5, or L5S1, and some of the answers may surprise you. Stay tuned. Hi, my name is Dr. Frank Altenrath, and I'm a corrective care chiropractor here at Valley Optimal Spine in Cresskill, New Jersey. And in today's video, I'm going to go over some of the most common questions I get asked from patients that have bulging or herniated discs, whether it's L4, L5, L5S1. And as I state in all my videos, these do's and don'ts and answers to questions are generalizations and they apply to most people. However, because everybody's case is different, always consult with your medical professional that understands your case to make sure that these suggestions are correct for you. So the first and most common question I get asked is ice or heat with a bulging disc or herniated disc. The answer is always within the first 24 to 48 hours of an injury, always use ice. Ice is going to help to reduce blood flow to the area, which will reduce inflammation and it will decrease pain. It's an analgesic. After that, after about a week or so, you can now play around with heat or ice, whatever seems to work best for you. I have patients that just love heat and it helps them. I have patients that use ice and it helps them. So try both. If you have any kind of question, you're not sure as to which one is better, try both. Try heat and then end with ice. But always end with ice because ice is a pain control mechanism and we want to end with ice if you're going to try both. But as I said, within the first 24 to 48 hours, always use ice over the area of pain. After that, you can try both, and if you're not sure, start with heat and then end with ice. The second most common question I get asked, which is also a do and don't, is can I walk? So people ask me with a herniated disc, bulging disc, L4, L5, L5S1, is it okay if I go for a walk? Well, the good news to that is that most herniations bulge to the back posteriorly and to the side. That is going to be aggravated by flexing your spine. Now when we walk, the good news is that we put our spine into extension. So as we're walking, we extend our spine naturally as we go through the walking gait. So walking is going to have a beneficial effect for most people because as you walk, the disc can actually start to move in from the posterior part of where it's bulging out back to the middle of the spine, which would be then actually relieving the pain. It could cause symptoms that are going down the leg. It can cause the symptoms to go back up into the middle of the back, called centralization. So walking is a good thing. So it's okay if you can tolerate it. Again, within the first 24, 48 hours, we don't want to do that. We want to rest. But once you're past that, a week or two where you're starting to feel a bit better, walking is definitely something that you should do. And that is going to be beneficial. If you're walking, however, and the pain is starting to be felt going further down the legs, then of course stop immediately. It's not right for you. But normally walking for the average person with a herniated disc or bulging disc is something that they can tolerate well. The next question I get asked is, what's the best way to sleep with an L4, L5, or L5S1 herniated or bulging disc? I'll leave a video link at the end of the video. I have a whole video on that. But in general, you do not want to sleep on your stomach. That will aggravate any kind of back pain usually. We do want to sleep on our backs with either a pillow underneath the legs, and I'll put some pictures in here to show you. You want to sleep with a pillow underneath your legs, elevating your legs a little bit if you're going to lay on your back. And then if you're going to lay on your side, we definitely want to put a pillow between our legs, laying on your side. So do not sleep on your stomach with an acute bulging disc or herniated disc, and make sure you put the pillows under your knees or between your legs if you're laying on your side. So the next most common question I get asked is, how long will my bulging or herniated disc take to heal? And the answer is, based on the research, that 50% of them, within 2 weeks, your symptoms may resolve. For the majority of cases, between 4 to 6 weeks, the symptoms will resolve. Now, you may still have the herniation if you went to take an MRI, but the symptoms will be gone and you'll be able to go back to your normal life. Interesting side note, there was a study done in Japan by Ito and Takano where the authors wanted to study the clinical outcomes of two types of herniated discs, contained or non-contained. Contained simply means that the jelly inside the disc was still within the outer fibers of the disc. It didn't break through. And non-contained meaning that the jelly actually broke through the outer annular fibers and was floating around. And the authors discovered that the larger the herniation, if it was non-contained, had a better clinical outcome, meaning that they didn't need surgery, as opposed to the smaller bulging discs that were contained. They believe it's because the body resorbs the material that's floating around and basically heals it itself. But they did say that if the patients could tolerate the symptoms for 2 months, up to 2 to 4 months, with conservative treatment at that time, they would have great outcomes with the larger non-contained discs. So the good news is that if your MRI findings say that you have a large herniation or whatever, don't give up. Try always conservative treatment first, and we want to try to avoid surgery. Now, the only caveat is, of course, if you have any kind of what they call cauda-equina syndrome, where you lose bowel or bladder control, or you have progressing neurological symptoms, muscle symptoms, weaknesses that are progressing, or if you have pain that's just so intolerable that you need to go back to work and you can't because of the pain. Otherwise, if you can wait the 2 weeks, the authors found 2 to 4 weeks, your clinical picture becomes better. Another common question is, can I go back to the gym? Well, again, during the first 24 to 48 hours, or the acute phase of a herniated disc, when it's really severe pain, you're feeling symptoms down your legs, we want to definitely not go to the gym. That's when we want to rest, put ice on it, bring that inflammation down. Once that stage has progressed, once 2 weeks or so have gone by, you can definitely go back to the gym. I'll put a link to a video at the end of this video to the best exercises to do at the gym with a bulging or herniated disc. But in the beginning stages, when it first happens, don't go to the gym, don't aggravate it. Let's bring down the inflammation, wait a couple of weeks, and then you can certainly go back and start working out. So the last thing I'll talk about is treatment options if you have an L4-L5, L5S1 herniated or bulging disc. In our world, in the corrective chiropractic world, we will have a patient come in, we give them a diagnostic workup, orthopedic tests, we do diagnostic x-rays, and we look to see if their alignment is normal or how far from normal their alignment is. And our goal of treatment is to restore as close as possible their spine to a normal spine, published normal in the literature, thereby taking pressure off of the nerve or the discs so they can heal. If that is something that the patients are not going to do, the other route would be, if it's minor pain, their doctors might prescribe NSAIDs, so they might take Advil or Motrin for the pain if it's not too severe. If the pain is very severe and not responding to those treatments, they may go and get an epidural injection. That's done in order to reduce the inflammation and swelling of the nerve that comes out of the nerve root, if that's causing the pain, or the disc in general. If that doesn't work, then the last step, of course, the last resort would be some kind of surgery, whether it's a discectomy where they remove part of the offending disc material, or they can do things like laminectomies where they go in and take pressure off of the disc from the back of the spine. They can do fusions when it gets more advanced and severe. All these things we try to avoid in our clinics, so we don't have patients go down that route, because there's a high failure rate with those type of surgeries where people have pains that come back later on, or they get adjacent joint disease and disc disease later on the areas that were not worked on, the areas above and below the area of the surgery. So we try to always use that as a last resort. If you found this video useful, hit the notification bell so you don't miss out on any of our new content. Hit the like button and consider subscribing to our channel. And if you have any comments on what you've heard, leave them down below in the comments section, and I'll get back to you as soon as I can. Thanks for watching. See you next time.